Hello friends, if you are enrolled in a Medicare Advantage plan right now, there is money sitting in your account at this exact moment that belongs to you. Not money you might qualify for someday, money that is already loaded and waiting, money your plan allocated specifically for you, and according to CMS data, roughly 70% of Medicare Advantage members never touch it, not because they do not need it, because nobody told them it was there. Today I am going through exactly what this benefit is, exactly how much is sitting in your account, and the one step it takes to claim it before it disappears forever. Stay until the end because the amount varies by plan, and some plans are carrying balances of $2,400 or more that expire this month if you do not act. Before we get into it, subscribe to this channel right now and turn on the bell. Medicare Advantage rules, benefit amounts, and expiration dates change every single year. When they change, your plan does not call you. I cover every update in plain English before the deadline passes. The people subscribed here claim what belongs to them. The ones who are not tend to find out after the balance already expired. Subscribe now and let us get into it. Here is what is happening right now. If you are on a Medicare Advantage plan, and roughly half of all Medicare recipients are, your plan almost certainly includes something called an over-the-counter benefit. An OTC benefit. This is a monthly or quarterly allowance that your plan loads onto a prepaid card or dedicated account. You can spend it on health-related items without a prescription. Vitamins, pain relievers, cold medicine, dental care products, first aid supplies, blood pressure monitors, compression socks, hearing aid batteries, incontinence supplies. The specific list varies by plan. But the coverage is real, and the amounts are significant. The average OTC benefit across Medicare Advantage plans in 2026 is over $400 per year. Some plans provide $1,200 per year. Some plans provide $2,400 per year or more. And according to CMS data, that is the Centers for Medicare and Medicaid Services, roughly 70% of these benefits go completely unused every single year. That is approximately $5 billion sitting in accounts that expire without being spent. Every single year. The most common reason is simple. People enrolled in Medicare Advantage either do not know the benefit exists, or they received a card in the mail, had no idea what it was for, and put it in a drawer. If that sounds familiar, you are not alone, and more importantly, you still have time to use what is yours. Let me explain exactly how this works. When you enrolled in a Medicare Advantage plan, your plan was required to tell you about all included benefits. But the OTC benefit is often buried in a welcome packet that arrives with dozens of other documents. Most people flip through it once and set it aside. Your OTC benefit is loaded on a schedule. Some plans load it monthly, some load it quarterly. The amount resets on that schedule, and here is the critical part: unused balances typically do not roll over. If your plan loads $100 per month and you did not use January, February, or March, those 3 months are gone. You cannot get them back. The April balance starts fresh at $100, and that is all you have. If your plan loads $300 per quarter and the quarter ends tomorrow without you spending it, that $300 disappears at midnight. It does not carry forward to next quarter. This is why the urgency is real right now in June 2026. We are at the end of the second quarter. If your plan operates on a quarterly cycle, your Q2 balance expires soon. Whatever is sitting in that account unused, it goes away. Now let me tell you exactly how to find out what you have and how to use it. Step 1. Find your Medicare Advantage plan member card. It is the insurance card your plan sent you when you enrolled, not your red, white, and blue Medicare card. Your Advantage plan card. It has a member services phone number on the back. Step 2. Call that number. When the representative answers, say exactly this: I want to check my over-the-counter benefit balance and find out how to use it. That is all you need to say. They will pull up your account and tell you exactly what is loaded, what it covers, and how to spend it. Step 3. Alternatively, log into your plan's member portal online. Most major Medicare Advantage plans, Humana, Aetna, United Healthcare, Blue Cross, Cigna, have online portals where your OTC benefit balance is displayed. Look for a section called Benefits, Extra Benefits, or Healthy Benefits. Your OTC balance will be listed there. Step 4. Spend it. Depending on your plan, you can use your OTC card at participating retailers, CVS, Walgreens, Walmart, Dollar General, and many others. Some plans also allow you to order directly from an online catalog and have items shipped to your home at no cost. The items eligible vary, but common categories include pain and fever relief, digestive health, first aid, vitamins and supplements, dental and oral care, eye and ear care, personal care, and certain medical devices like blood pressure monitors and glucose testing supplies. If you are not sure whether a specific item is covered, the member services number on the back of your card can tell you in under 2 minutes. Now let me talk about the people who are most likely to have a large unused balance sitting right now. If you enrolled in your current Medicare Advantage plan during open enrollment last October and November, and this is your first full year on the plan, there is a strong chance you received an OTC card in your welcome materials and never activated or used it. If you switched plans this year, same situation. New plan, new OTC benefit, new card that may be sitting unopened somewhere. If you have been on the same plan for several years but never looked into the OTC benefit, your balance has been resetting and expiring every single quarter without you collecting $1 of it. Here is what that looks like in real numbers. A plan with a $100 monthly OTC benefit. 6 months of unused balance. That is $600 that expired. Gone permanently. A plan with a $300 quarterly benefit. 2 quarters unused. That is $600 gone. A plan with a $2,400 annual benefit paid quarterly. $600 per quarter. If you have never used it and 3 quarters have already passed this year, $1,800 has already expired. You have 1 quarter left to claim $600 before the year resets. These are not hypothetical numbers. These are the actual benefit structures that exist right now across major Medicare Advantage plans in 2026. Now here is something important to understand about why your plan does not remind you. Medicare Advantage plans are run by private insurance companies. They are paid a fixed amount by Medicare to cover your care. When you do not use your OTC benefit, that money stays with the plan. They have no financial incentive to remind you to spend it. Your plan will not call you when your quarterly balance is about to expire. They will not send a text. They will not email. They process the expiration quietly and your next quarter starts fresh. The only person who benefits from you knowing this is you. Now let me address something that confuses a lot of people. Not every Medicare Advantage plan has an OTC benefit. Some lower cost or basic plans do not include it. If you call member services and they tell you your plan does not have an OTC benefit, that is your signal to check your plan options during the next open enrollment period in October. Plans with robust OTC benefits, $1,200 to $2,400 per year, exist in most counties across the country. If your current plan does not offer one, there may be a comparable plan in your area that does. You can compare plans at Medicare.gov or call 1-800-MEDICARE, that number is 1-800-633-4227, and ask a Medicare counselor to help you find plans in your zip code that include an OTC benefit. You do not have to pay more to get this benefit. In many cases, the plan premium stays the same or is even lower. Here is the summary. If you are enrolled in a Medicare Advantage plan, you very likely have an OTC benefit sitting in your account right now. The average is over $400 per year. Many plans carry $1,200 to $2,400 or more. Roughly 70% of this money goes unused every year because members do not know it exists. Unused balances expire on a monthly or quarterly schedule. They do not roll over. Once the period ends, the money is gone permanently. To check your balance right now, find the member services number on the back of your Medicare Advantage card and call them. Ask specifically about your over-the-counter benefit balance, or log into your plan's member portal online and look under benefits or extra benefits. To spend it, use your OTC card at CVS, Walgreens, Walmart, Dollar General, or your plan's online ordering catalog. Vitamins, pain relief, dental care, first aid, blood pressure monitors, and dozens of other health items are typically covered. If your plan does not have an OTC benefit, Check your options at medicare.gov or call 1-800-633-4227 during open enrollment this October. One phone call tonight. That is the difference between the money expiring and the money being yours. Subscribe. Share this with every senior you know who is on Medicare Advantage, and I will see you in the next one.